And this is how the COVID-19 virus, we all are aware how it looks like. It has a membrane protein and it has spike proteins and a nucleoprotein inside, which governs the mutations probably. So, like all other viruses, COVID-19 also went through a lot of genetic mutations. These mutations were basically seen more on the spike protein. This spike protein, which is adhered on the new envelope, is responsible for adherence of the virus to the human cell. And this Omicron variant has got mutations in this spike protein. And there are 32 mutations in this spike protein, which we see here. And then, but the scientists are still working on which variant is more dangerous, more virulent, and all that. But we ourselves have seen that Omicron variant is more rapidly transmissible, but its infectivities to the individual may not be that severe. It may lead to mild to moderate infections. The severity of infections is less, but transmissibility is really a big issue here. As we know that the mutations on the Omicron spike protein was due to cluster of mutation. There are 30 mutations on the spike protein, which was identified, and there are different names to these mutations. Okay, and there are other variants also. What we have seen from April 2020, we have seen alpha, beta, gamma, delta variants of COVID-19. As we know that till 2020 April, we were not sure what variant and which type of COVID virus it is, whether it is alpha, beta, gamma, delta. But December 2020 onwards, and August 2020 onwards, we saw the different variants like alpha and then beta, and then in 2020 December, we saw deltas, erupted, which led to a lot of mortalities. And as we know that WHO labeled these variants as variants of concern, and alpha variant was identified in United Kingdom in September 2020. Beta variant was identified in South Africa May 2020, and then gamma variant was identified in Brazil in November 2020. And we saw Omicron variant. Okay, the Delta variant was predominantly, identified and first documented in October 2020 in India. And in South Africa, we saw Omicron virus, which is identified in November 2020. So these are some of the mutations which are identified. Very difficult to remember their names and their codes. So, but we just want to discuss about Omicron variant and how it has affected this, pandemic. I would like to have a lot of highlight on that. As we know that WHO has come up with guidelines pertaining to the prevention and spread of Omicron viral infections, as it has several mutations, and it is also expected that more and more mutations would be likely seen over over a period of time. But what is identified and peculiar about these mutations is like these mutations have led COVID virus, probably less infective, but it is more transmissible. As we know that the spread of infection from one individual to other with delta or alpha, beta, gamma was around 2.5 to 3 individuals. But with Omicron variant, the infectivity, the spread, transmissibility, probably the transmissibility is higher, maybe 7 to 8 individuals. And then this Omicron variant persists on the surfaces for longer duration, whereas the other variants were persisting for 24 hours, 48 hours or so. But recently, we came across with the news, and some Japanese studies have shown that Omicron variant can remain persistent on surface for 20 or live on 20 for 21 days. So that is how, the surfaces are the major source of infection as far as the spread of Omicron virus infection is concerned. So these are the different variants we have seen, but the Delta was more responsible for the deaths and the case fatalities. Whereas with Omicron, the case fatality is still less, but the transmissibility is very high. So how do we identify these patients with COVID-19 now? Because now we have seen other infections like influenza, and then other bacterial infection becoming more prevalent in winter season. COPD exacerbations become more prominent, and asthmatic exacerbations are also seen. So, how do we identify these COVID-19, and what are the symptoms that will help you to have a strong index of suspicion? So, any patient who has fever, and high grade fever, and if it is associated with the chills, is quite peculiar of Omicron virus. Whereas with the previous Delta virus and the other strains, the fever was there, but probably the chills were not associated. This Omicron variant behaves like influenza, common flu virus. Okay, and then there is a blockage of the nose. There will be running of the nose also. Running nose is more prevalent with Omicron, whereas running nose was not very common with the other variants. And then you will have cough with expectorations are also seen. Okay, previously with the other variants, the cough used to be very dry, and then Omicron has cough with some expectoration. And there is with severe COVID-19 infection with Omicron, there will be shortness of breath, there will be difficulty in breathing, and body ache, muscle ache, weakness is also seen. There are other symptoms like vomiting, diarrhea. Patient may present directly without respiratory symptoms, and GI manifestations are also common. Diarrhea, enteritis, gastritis is also very common. But there is no loss of taste or smell with this variant. This is one more peculiarity of the Omicron infection, whereas with the other variants, Delta and the other variants, you have seen loss of taste and loss of smell. Here with the Omicron variant, people are not complaining of loss of taste and loss of smell. Yeah, but the two variants or three variants may coexist together. So there may be overlap of symptoms. Some patients may have symptoms of Delta like, and then they may have symptoms of Omicron. So it is COVID and cold like illnesses, the incidence is also rising, where with the last year we've seen only the COVID cases were identified, but now we have seen COVID and respiratory infections are also associated with concomitant infections of influenza, para-influenza, respiratory syncytial viral infections have also coexisted with COVID-19 infection. And then the different strains of COVID-19 like Delta and Omicron variants have also contributed to the common cold-like illnesses, and the symptoms are not exactly a lot